Is mental illness an identity? I'm joined by my friend and colleague today, Gilde, licensed clinical social worker.
If I'm somebody who self-isolates and I have been isolating to take care of myself, right? Because I'm in care, and then now I've completed care, but I continue to isolate, what is that really going to do? I've had several patients who say, I am not my diagnosis. And I love when they do that. They have to remind themselves of that, right? They have to understand that this is a huge part of my life right now, but the goal is for me to really hone in on what's going on so that it doesn't have to be a forever thing.
They forget what life was like before they got the diagnosis.
You see it a lot with families. You see it a lot, mothers who, well, that's his diagnosis. That's why, it's because of his depression. And granted, it's not an excuse. People do really struggle. They do have symptoms, but you have to kind of know when to also empower them.
This episode of Candid Minds with Dr. T and Friends is brought to you by Mindful Care. Welcome back to another episode of Candid Minds with Dr. T and Friends. I am Dr. Tamir Aldad, addiction psychiatrist and the CEO of Mindful Care. I'm joined by my friend and colleague today, Gilde, licensed clinical social worker. And today we're discussing, is mental illness an identity? Jackie, this is certainly a concern as I treat different patients who slowly start to assess their diagnosis and at times go down a slippery slope where the diagnosis consumes them. And I find that this can happen in a lot of areas of medicine, particularly in chronic illness, where patients require constant recurring treatment, and also in mental illness. And here we'll focus on mental illness, but I would say as a general statement, I think it is quite dangerous if a patient or an individual is consumed by their diagnosis, no matter how time-consuming the treatment is, no matter how much research it takes, or traveling to a lot of doctors and doing everything to get better. A lot of times I feel like that could dilute who that person is as an individual and might even enter a space where they forget what life was like before they got the diagnosis, meaning all they could remember is taking their medication and being hospitalized and going to doctors and being in a partial program or being in an IOP. And basically all your whole life revolves around taking care of your mental health. And then you start plugging in other aspects wherever you can. So whenever you can, you might work. Whenever you can, you might be with family. And even though at first that might look like you're prioritizing your well-being, I feel like long-term it could lead to negative consequences.
Absolutely. Because first and foremost, for you to start to identify with something that you are working so hard towards is understandable, right? It becomes so much of who you are because in that period of time where maybe you are going to partial or maybe you are seeking a lot of care at that time, it is so much of who you are. But the point is to get that intensive care in the beginning and then to give yourself the tools and skills and then move away from that intensive care right to a maintenance phase of really just being able to maintain your mental illness. But in that time where you are receiving intensive care, you're eliminating other factors of your life. Maybe you're not able to go see your family and friends as much as you were able to. Maybe you're not participating in the extracurricular activities that you used to participate in. And so reincorporating that could be a struggle as well. It also could be a trigger. People could be afraid to reincorporate those things into their lives out of fear that I finally have my mental illness at a place where I'm stable. I don't want to take the risk of that. But then it also can play into maybe some factors of your mental illness. If I'm somebody who self-isolates and I have been isolating to take care of myself, right, because I'm in care, and then now I've completed care, but I continue to isolate, what is that really going to do? And so, we do see it quite a bit. It's a journey. It's a journey that is a lifetime type of thing, and it's not easy to always navigate. But I've had several patients who say, I am not my diagnosis. And I love when they do that. They have to remind themselves of that, right? They have to understand that this is a huge part of my life right now, but the goal is for me to really hone in on what's going on so that it doesn't have to be a forever thing. But you do see people who get lost in their journey, and it does, they lead with their mental illness rather than just being a piece of them. It becomes who they are as a whole.
Yeah, one thing I found helpful when coming up with treatment plans is making sure all the goals aren't all clinical.
Yes.
Especially, in depression, we talk about behavioral activation, pushing someone to do activities even if they don't want to get them out of that cycle. But I think it's very important to come up with goals where you still have a purpose. If your entire treatment plan is taking your medication and going to therapy and going to groups and doing all these things that are clinical, if you see that every day and you're checking off those boxes, you might slowly stop appreciating the bigger picture. So I think it's really important when setting goals for yourself, you still have personal goals, family goals, work goals, educational goals. So you're not constantly living in the world of your diagnosis and feeling like that's all you're supposed to be doing, but you could actually push beyond that because eventually you will effectively rematriculate into your life.
And that's important for that to be from the beginning of care, not okay, you've this is subsided, we're going to work on this now. And so think about it, the types of assessments we do, biopsychosocial assessments, that's looking at the patient as a whole, different areas of their life. It's not just honing in on mental illness, it's asking about employment, it's asking about their families, their social component. And a good treatment plan is identifying all of those aspects of an individual's life. You learn a lot from a patient when you're doing a treatment plan, right? And you also learn what they're afraid to even touch with a 10-foot pole, right? But what type of clinician would I be if I'm not encouraging my patient to at least attempt, right? A treatment plan is not this like set in stone type of thing. But if I see that they're struggling somewhere and they are identifying struggling somewhere, it should be there. But the point is that a treatment plan should not only just be what their diagnosis is, it should be capturing all areas of life.
And be comprehensive in a sense. What if they're not giving you anything to work with? Like they're not ready, they don't have any goals, nothing matters, they're in a pretty dark place, and you're trying to be optimistic and you're trying to create this treatment plan, but the feedback is limited. How do you navigate that?
I come from a place of settings where we had a lot of mandated clientele, and that is a very difficult clientele to do treatment plans with because not everybody is always accepting that they need help. And so you have to start somewhere. And I have had sessions where they just want to sit there in silence, and I mean, then that's not just a treatment plan that's done in one day. It takes some time. It's ever evolving. And, you start with the diagnosis, you start with the legal, you start with attendance and treatment. Something so small is really big for somebody like that because they're resistant. They don't want to really identify anything else. And I also will tell clinicians not to be afraid to add on as time goes, is that you're not getting the full picture right away. You're not getting the full picture, even as thorough as our assessments are. And that it's okay that throughout treatment to say, let's revisit, let's do an update on your treatment plan. I'm noticing some things that you're now bringing up that weren't, but you may sometimes with that resistant clientele who's not really interested in getting care, they're not going to be as forthcoming. And it's really going to be up to you to hone in on your skills and really help them to identify something. You're here for a reason. What is that reason? What is your why? What's the why? And helping them to identify that there is something that could be tied to that why. Because sometimes I'm here for my legal. Well, what caused the legal? Well, this is what happened. And then, well, what caused that? Well, I had a fight with my dad. So you start to get a little bit more information, but really being able to use motivational interviewing and, pulling, but also being respectful of what they're willing to engage with and the conversations they're willing to have and not have.
Yeah, I've noticed though, it's easy to sit here and tell patients don't make your diagnosis your identity and look past it.
It's a huge statement.
For sure. But I'm wondering if perhaps as a healthcare system and as clinicians, have we contributed to creating, identifying a patient by their diagnosis, even if they don't see themselves as their diagnosis? Meaning, we'll look at someone and say, oh, well, that's their IBS, that's their fibromyalgia, that's their borderline personality disorder. Where perhaps as a healthcare system, we might be guilty too of identifying and labeling people and then categorizing them and then not seeing beyond that because now we've effectively put a label on them.
I do feel that we have contributed to that. I think I personally feel that from when I got into the field 15 plus years ago till now, things have changed dramatically. But I do feel that when I first entered in, even as an intern, that people were their diagnoses, even to clinicians. And we really spoke to them quite a bit about it. It was very heavy on that. And we viewed them like as a DSM textbook diagnosis rather than as an individual that has different components of their lives. And maybe it was just the settings I was in, but I do feel that there has been a big movement within the healthcare system. I talked about this a couple of episodes as well, is looking at the individual as a whole and to really see them for who they are, not necessarily what their diagnosis is. I don't think that there is harm in understanding that sometimes people present a type of way because of that's what their diagnosis is, right? That's okay. But when we start to act like every single thing is because of what their diagnosis is, it becomes a really slippery slope. And I think it just engages and encourages them in identifying that they are their mental illness. And I want my patients to be proud of their mental illness. I want them to be proud of their journey, of the work that they're doing to get better. There's no harm in that, but it also could be dangerous when you're not in a good place and you could start to really get lost in that. When you have a separate identity outside of your mental illness, it helps you start to navigate that this is just a component of my life and who I am, rather than this is who I am.
Yeah, and I think if we really push patients and the healthcare system to break that connection where individuals are tied to their diagnosis, it'll challenge patients to push through stressors even more. Meaning, if you're in a situation where you'd navigate it and you'd use the coping skills you're learning and you would try to be resilient, but now everyone around you is saying, listen, the way you're reacting is because of your depression.
Right.
That actually is doing you a disservice because independent of being depressed, I need to know how to navigate this situation. I need to know how to react. I need to know what to do. I need to know what skills to tap into for how long. So we could actually be paralyzing the patient by constantly tying their experiences to their diagnosis versus explaining to them that, yes, this is a symptom or it's a sign, but this is how we're going to work through it. These are the skills we're giving you. It's transient in a sense where this won't consume you and you shouldn't let it be a barrier because ultimately we want to see you across that finish line. So I think eliminating the connection to the diagnosis being a part of your identity is really empowering.
And it's not just the healthcare system that does it either. You see it a lot with families. You see it a lot, mothers who, well, that's his diagnosis. That's why, it's because of his depression. And granted, it's not an excuse. People do really struggle. They do have symptoms, but you have to kind of know when to also empower them. And I think that that's a huge component in people being, successful in their care, is having those people around you who are saying, I know that this is a hard time. I know that you're struggling, your depression, but let's do this. I'm here to support you through it, but what did you learn when you were in care? And not being afraid to push a little bit, not in a detrimental, toxic way. And I'm here to support you. I know what's going on, but also not allowing your loved one to define themselves that way either, because there's so many different components of the people in our lives, and we love them for an array of different reasons. And their mental illness is not the only reason we love or do not love them, right? There's different components to people. And I think that that's really important for families, is that the healthcare system has come a really long way. There's a lot of resources to get individuals help, but it also is a huge component of what's going on at home as well, or what's going on with my significant other. And it's okay. You don't have to be afraid to hold the people you love accountable just because they have mental health concerns. And I think it's a very sensitive topic, and people are very afraid because certain diagnoses, there's a dangerous component of it, and they're afraid that they'll push somebody to a point. But caring about somebody and loving them and encouraging them is most certainly not pushing them to a point that they wouldn't have gotten to on their own anyway.
Absolutely. I see this also with IEPs,
Yes.
individualized educational plans, where students with different learning needs are accommodated in schools. And I always exercise caution and alert parents that you really want to make sure your child is learning the appropriate tools
Yeah.
to navigate how to best learn, right? They could be developing compensatory skills if they didn't have any support. But with this IEP, it should not just be that your child now doesn't do anything because everything is being accommodated for,
Right.
right? It's really meant to support them and be a tool and be resources. So even if you have a diagnosis that you learn differently, it's important there as well to make sure that you're still being given the resources and the tools to be able to navigate life and not just depend on all that extra support that you're getting through your IEP.
Absolutely. But also to helping, I think even with students with IEPs is I don't know if that's always explained to the student. I don't know if they're always made aware of this is a tool of how you do this. They're just kind of going about things, right? They're just kind of pushing them through school and giving them the support while they're there. But I actually think it'd be really nice to, and I know a lot of districts do this, but as the child is age appropriate, include them in that. What do you need and why do you need that? And have them at the IEP meeting. I think that that's huge. I used to work with some adolescents that were at risk for the PINS department and at probation, and they did include them. And it was really helpful to, for the family members to hold them accountable and to help them, work their way through their goals within school. But also that when they came out of school, they understood where maybe some of their shortcomings were and also ways that they could learn differently and work around those shortcomings that ended up becoming strengths of themselves.
Yeah, no, and it would empower the child. At the end of the day, if you're a part of that journey, you understand what your challenges are. You understand where you're getting support and resources, and you know when to ask for help. And it actually turns it around where it isn't just your identity that you learn differently, but rather you know what you're good at, you know your strengths, you know your challenges, and then you're able to overcome because of the additional support and the extra skills that you've been given. So together, it's really helpful and really important.
I love that you said empower. I think that that is huge, and people sometimes can perceive pushing and holding people accountable and you know expecting them to rise as this uncomfortable thing that they shouldn't do. But what better way to give somebody skills and to help them get through life than to empower them? We could easily do things for the people that we love, whether it's mental illness or a learning disability. And listen, it really applies to what that individual actually needs, right? It's not a one size fit all. But empowerment is huge. And when you do a lot of reading on empowerment, you see how impactful it is for people with even the worst of the worst diagnoses, that having somebody behind them that supported them through it and empowered them and gave them skills and gave them tools really sets them up for quite a bit of success. And that, I mean, it depends on what you're defining as success. But I think I just love that you said empowerment, because I think sometimes that can get misconstrued. And as a parent or a spouse, you're afraid to push a little bit, not realizing that one day they may describe you as somebody that empowered them.
Absolutely. And I think that is a strong point to end on, that we should be empowering individuals, no matter their diagnosis, to see beyond their diagnosis, not have it be a part of their identity, understand that they are going to navigate what they're going through and be better for it afterwards, and be stronger. So certainly a great conversation as always. Thank you for joining me. To our viewers, we appreciate you joining us today. We look forward to seeing you on our next episode.